I'm Dr. Kathleen Davenport. I'm the Director of Physiatry at HSS Florida. Physiatry stands for Physical Medicine and Rehabilitation, or some people call it PM&R. One of the ways that we describe it is non-surgical orthopedics. So we do very similar things that an orthopedic surgeon does, but instead of surgery, we will do things like procedures like injections, including platelet injections or guided injections like with an ultrasound or an x-ray machine called a fluoroscope, and it helps us be very precise. So we pride ourselves on very good diagnoses and then very precise treatment plans. Sports medicine is the treatment of athletes, but we tend to define athletes very broadly. So when I say I'm a sports medicine doctor, yes, I'm the company physician for Miami City Ballet, and I see a lot of professional athletes. But I also look at it as treating people who want to do whatever it is that they enjoy in life. So whatever sport or activity that might be for you, whether that's golfing or tennis, walking with your children, playing with your grandchildren, whatever that is, my goal is to help you towards your functional goals. I see patients of all age ranges as well as all activity levels. Again, physiatry really is a specialty about function. So whether you're functioning as a professional ballet dancer or whether you're functioning as someone who's trying to walk one block instead of 2 blocks, those are things that we can come in and help improve function. We really focus on wellness, keeping people functional. So when we're talking about a diagnosis, injuries, or even better, a preventing injury or risk reduction of injury, we really want to look at a team approach as well as focusing how we can optimize how people are moving. There is no better feeling as a physician to see success of a patient. For my professional dancers, to see them back on stage and knowing I had a small role on that, there is literally no better feeling in the world than seeing that.